We've talked about peripheral artery disease, or PAD, before here on Good Day PA. Did you know that folks with diabetes are at an increased risk of developing PAD? Since November is Diabetes Awareness Month, we're taking some time to learn what you should be on the lookout for. Cardiovascular Experts is sponsoring this segment, and Dr. Raj Dave is back with us this morning. How does being diabetic increase a person's risk for developing vascular issues?
Well, diabetes affects the inner lining of the blood vessels, and it makes blood vessel, I would say, less flexible. So the flexibility of the blood vessel is very important because it allows the blood to flow very smoothly to the different organs in the body. And when the diabetes affects these arteries or veins, it becomes very rough inside, and it leads to plaque buildup, usually from fat deposition. When the plaque gets built up, you develop a blockage. So there are many organs that get affected by diabetes. Most importantly, peripheral arterial disease, which affects your legs, because you have a blockages in the leg arteries. And then there's other arteries get affected in the body, such as heart arteries and the brain arteries, and it can lead to heart attack and the strokes.
Is this something that you can feel happening? Like, are there symptoms?
Yeah, so it's a very important question. And I think that your viewers should always be on the lookout for this, because when you develop a blockage in the leg arteries, especially, you develop leg pains that occurs usually with walking. Sometimes patients experience numbness in their feet. Sometimes they develop ulcers. If somebody is not very active, and that's pretty common in our community where they have diabetes, they typically might not feel any symptoms, but they develop, infection in their nails, they lose hair in the legs, and these are all the signs of lack of blood flow in the leg arteries, and that should be evaluated by a physician.
It's interesting because those symptoms, it seems like something you could kind of brush off also, like, oh, I have some pain in my legs, or, so when they're experiencing these symptoms, what can you say about the importance of checking in with your doctor?
It's very, very important, because peripheral arterial disease, for example, is a very dangerous disease. It leads to amputations. So it's important to get screened, and the testing for diagnosing this condition is very, very simple, because we can do simple ultrasound and be able to tell if somebody has developed any leg artery blockages, and the treatment can be initiated as soon as we can diagnose the patient. So it's very, very easy. It doesn't require any invasive procedures or big scans or anything like that. It's very cheap to have an ultrasound done. So that's the beauty of the diagnosis.
Is there a way that somebody who's watching, maybe this is new information to them, they can learn more about that connection between diabetes and PAD?
So certainly they can go to our website. Our website has a specific page dedicated to diabetes and peripheral arterial disease and diabetes impact on the heart as well as on the brain. Because I mentioned that diabetes can not only affect the leg arteries, but can also affect the heart arteries and carotid arteries, and can lead to strokes and the heart attacks as well. Okay. So there's a lot of information available on our website for your viewers.
Very good. Well, thank you so much. Great information here today. We're actually going to have more from Dr. Dave later in our second half hour. We hope you'll stay with us as we go to break. We thank Cardiovascular Experts for sponsoring the previous segment. We'll be right back.